Ay, pobrecita sobrina. ¿Cuándo va a llegar el doctor?
Aunt Louise, please, in English.
I was just wondering when the doctor will arrive. We've been here at this urgent care forever. I wish you would just take some more insulin so we can just leave.
Aunt Louise, this isn't for my diabetes, I promise you.
It's been a busy day. This is my lunch. I'm Dr. Anderson. Okay, Barbara, says you hurt your foot playing soccer.
Ay, Dios mío, doctor. This is Patricia. Who is Barbara? Anyway, Patricia is a diabetic and her stomach hurts. I think we both know what happened here. My niece got into the candy drawer when I wasn't looking. Can you just please explain to her why she shouldn't do that and we can just go home?
So, you're not Barbara?
Doctor, I swear I didn't eat candy. Besides, this pain is different. This isn't for my diabetes, I promise you. Please, can you make the pain go away?
Patricia, we know that you like to sneak the Snickers and the Pop-Tarts. Just be honest, and we can stop wasting this doctor's time.
Oh, Tia, just give me something for the pain, please.
Wait a minute. I think I've seen you before. I think I know what's going on here.
What?
Have you been here before?
Yes, this is very sad. I won't be giving you any pain medication until you've had a psych consult. And I know real pain when I see it. Does she have a history of drug abuse?
Drug abuse? Excuse me. This pain, this is real. She's not faking it.
This is not about stomach pain. This is about teenage angst.
I don't want to see a psychiatrist. I just want my belly to stop hurting.
You don't have to see a therapist, but I will have to make a note in your chart that you're non-compliant.
What is non-compliant?
It means you eat candy.
Well, if you will excuse me, I have many patients to see.
Aunt Louise, what is he talking about?
No sé, mijita. Ay, lo siento.
Now, that visit didn't go well, did it?
Ay, Dios mío! Who are you?
Oh, never fear. The advocacy advocate is here.
The advocacy advocate? Seriously?
Look here, señorita advocacy. My niece has had a tough day and so have I. We are no more for your theater.
Let's stop a minute and think of the things that went wrong here with Aunt Louise and Patricia. Now that you have a better understanding of the healthcare maze and how to communicate with healthcare professionals, don't you think we could have had a better outcome?
It's been a busy day. This is lunch. I'm Dr. Anderson.
I see.
Okie dokie, Barbara. Says here you hurt your foot playing soccer.
Whoa, time out. Do you see anything wrong here? I do. He called her by the wrong name. Do you think maybe he has the wrong chart? And he started to do an examination before washing his hands. What would you do in this situation? Well, lucky for Aunt Louise and Patricia, I have a magic advocacy and action wand, and I will now wave it over them, and we will see how they handle this situation with advocacy skills.
Wait. Stop. Please, doctor. I am concerned. You called my niece by the wrong name, and she did not hurt her foot. Can you please check to see if you have the right chart? I would like you to check to see if we're on the same page.
Oh, actually, I have two charts here. The chart of another young woman was placed in your chart. Are you Patricia?
Yes.
And you're here for acute abdominal pain?
Yes.
Oh, okay. Well, let me fix the bed and let me see what I can feel after I get you to lie back for me.
I have to ask you to stop again, doctor. I know this is a busy place with a lot of sick people, but I didn't see you wash your hands. Could you please wash your hands before you touch my niece?
Oh, it's okay. I washed them before I came in.
I'm sure that you did, but it would make us feel so much more comfortable if you would wash your hands again. Here.
Oh, okay.
Thank you.
Okay. Well, I don't feel anything. Did you eat anything unusual lately?
My niece, the diabetic, likes to get in the candy drawer when I'm not looking. Can you please tell her to stop that so we could just go home?
Doctor, I swear I didn't eat candy. Besides, this pain is different. This isn't for my diabetes. Please, can you make the pain go away?
Patricia, you know you like to sneak the Snickers and the Pop-Tarts. Just be honest, and we can stop wasting this doctor's time.
Uh-oh. The advocacy dust must have worn off. This darn wand needs some repairs. What did you see here? I saw a patient and family that were not working together as a team. Let me give this thing a few smacks, and then we'll try again. This time, maybe Aunt Louise can use S-bar to make it a more productive conversation.
Well, I don't feel anything. Have you eaten anything strange lately?
My niece has been having severe stomach pains for the last 4 hours. The school nurse called me because her mother is out of town. My niece has a history of juvenile diabetes, and she was diagnosed at age 12. She has been insulin dependent since that time. She is now 16, and she is mostly stable, with the exception of the occasional times she cheats. At first, I assumed my niece had gotten into the candy drawer. Sometimes she gets stomach pains when she eats things she's not supposed to. But she knows her body. My niece says this is not typical pain. I believe her. I think we should take this seriously. I want you to run whatever necessary exams and tests to find out why she's in so much pain.
Wait a minute. I think I've seen you before. I think I know what's going on here.
What?
I will not be giving you any pain medication until you've had a psych consult. And I know real pain when I see it. Does she have a history of drug abuse?
Drug abuse? Excuse me. Doctor, this pain is real.
This isn't about stomach pain. This is about teenage angst.
I don't want to see a psychiatrist. I just want my belly to stop hurting.
You don't have to see a therapist, but I will have to make a note in your chart that you're non-compliant.
What is non-compliant?
So, if you'll excuse me, I have many patients to go see.
No, doctor. I need to cuss right now. I am concerned that you have suddenly dismissed this young lady's obvious pain. I am uncomfortable with you throwing words around like psychiatry and non-compliant when you haven't even done the exams and lab work. I am scared that my niece is seriously ill and needs immediate attention. If you walk out this door without exploring all the possibilities, I think we have a safety issue on our hands. I want to get serious about diagnosing my niece.
Well, okay, but it's a waste of time and resources. Well, Patricia, I apologize. You were right. You really do have acute pain, and it's not related to your diabetes. I'm afraid you have acute appendicitis, and we need to get you to the hospital in case you need an operation.
Told you.
Oh no, is she going to be all right?
Well, there's risk to any surgery, but I feel confident in saying that she's going to be okay because this is a very common surgery.
Thank you, Dr. Anderson.
Yes, thank you.
Oh, I don't think I deserve thanks. In fact, I apologize because I thought you were faking it.
This is okay. You listen in the end, and that is what matters.
You're a good advocate, Miss Louise.
Can we get this appendix out now?
That went a lot better this time, don't you think? 3 steps to advocacy of the moment, making the family a team, S-bar, and cuss. Aunt Louise did a great job being an advocate.